Another way to look at the blood flow through the heart is here we have our heart, and then coming out of the heart we have the aorta, like so. And immediately, as soon as it comes out of the heart, it's going to give off a couple of blood vessels on either side. And so the first one here is the left coronary artery. It's going to split down into an anterior interventricular and then come off this way as a circumflex. The right coronary artery comes off this way. It's going to drop down a marginal artery, and then it's going to continue around the back and then drop down the posterior side as the posterior interventricular. And so we have our aorta here. We have our left coronary artery. We have our right coronary artery. We have our circumflex. We have our anterior interventricular artery. Our right common carotid comes down and gives us our marginal, and then continues on, and eventually on the posterior side becomes the posterior interventricular. That blood then needs to get back from the heart, and so in terms of blood flow coming back, we now have our veins. And coming up the anterior side of the heart, we have our great cardiac vein. The great cardiac vein is going to continue around the back of the heart as well. We then also have a couple of other blood vessels that is going to join it there, and all three of these blood vessels are going to join into the coronary sinus. So here we have our coronary sinus right there. Coming up the posterior side of the heart, we then have our middle cardiac. And so this was the great cardiac. And then lastly, we have kind of coming along the right side of the heart and then meeting into that coronary sinus as well, we then have our small cardiac. So for the arteries, they are coronary, and for the veins, they are cardiac. Next up, we have the blood flow as it comes out of the heart and then goes up to the head and arms. And so again, coming out of the heart, we have the aorta, and then it comes to the aortic arch. The aortic arch then gives off three branches. And so we have the aorta, we have the aortic arch. We now have the brachiocephalic trunk. We have the left common carotid, and then we have the left subclavian. The subclavian and the brachiocephalic trunk, in a sense, are going to become equal to one another here as they start to come under the clavicles. And so the brachiocephalic trunk essentially turns into the right subclavian. And then we're going to come down into the arm, and it's going to become the axillary, and then the brachial, and then a radial, and an ulnar. And the same thing's going to happen over on the left side, axial or axillary, brachial, and then ulnar and radial into the arms themselves. Axillary there, brachial, and then radial and ulnar on those. The left common carotid is going to continue up to the head. The brachiocephalic trunk is going to give off a right common carotid, and so we're going to have that come off on that same side there, going up to the head as well. And then those are eventually then going to come back after they've delivered their blood to their particular area of the body. Those are then going to come back and move to the side of the head. So common carotid split into an internal and an external carotid, They then go up to the brain, and then they start to come down from the arms, or from the head and neck, and they're eventually going to join those veins from the arms as well. And so coming from the arms, we have our brachial veins bringing blood back. I'll draw another heart over here. But these can basically be superimposed on one another. And so we have our brachial vein here. Brachial vein turns into the subclavian, and then eventually drains into the brachiocephalic trunk vein from there. And then we have the same thing over here. Those two join together, and we get our superior vena cava. Here's our subclavian, here's our brachial. We have our brachiocephalic trunk right in the middle there, coming back in as well. We have the jugulars bringing blood back into the system as well. And so coming down from the neck itself, on the left-hand side, it comes down here going into that brachiocephalic trunk that is there. On the right-hand side, we have the jugular vein coming down over here and joining in, and then those get us into the superior vena cava, and then back into the right atrium. There's our interventricular, and then there we have blood now coming back in to that right-hand side of the heart, and then eventually going back out through the aorta again. And so that's going to follow that same pathway on to the other part of the picture there. So for the lower extremity, we have, once again, the heart, and then we have the ascending aorta, the arch of the aorta, then the thoracic aorta, and then as it goes through the diaphragm, about in here, it changes name over to the abdominal aorta. So we'll have our thoracic aorta, we have the arch again up here, we have the ascending aorta over here. We now have our abdominal aorta here, so we have our AA there for that. The aorta then continues on down. It splits into two common iliacs. The common iliacs will actually give off small little branches there going down into the pelvis called the internal iliacs. Right in there. The continuation of the common iliac then is going to go out into the thigh. And once again, it's going to go through a structure here. So we have the inguinal ligament. And once it goes through there, it's going to then change name into the femoral artery. As it continues on down, and it gets to the knee, and then finally down into the lower leg here. In the knee, it's going to become the popliteal, and then the tibial as it continues on down the leg itself. And we'll have the exact same thing on either side for the right and the left sides there. And so we then have the tibial here coming to the other side there. So to get the blood back, we then have to go through a series of veins. And so we'll draw our heart back up here for where we're going to get the blood back to. And again, we start in the lower legs. And so we're going to come up through a tibial vein. That's going to drain into a popliteal vein, and then into a femoral vein as it continues on from there. So again, here we have the tibial, we have the popliteal, we have the femoral, and then as it then goes through the inguinal canal again, come up the other side, the two of them are going to join back together, and we once again have our external iliacs The external iliacs are then going to come together, and we're going to have then where the internal iliac once again comes in. Those external iliacs then change name to the common iliac. Once they come together, the vessel then becomes the inferior vena cava. And so the inferior vena cava is going to come on up, and it's then going to drain into the right atrium. The superior vena cava would be coming in from this side, and then we have once again our 4 chambers there. So then we come back into the right atrium from that side for both the inferior vena cava as well as the superior vena cava up here. And that's the circulation through the vessels as you need to know them.